This is a brief introduction to your Medicare choices, and when it comes to Medicare, you do have a number of choices to make. But first, let's take a look at how Medicare works. Part A of Medicare is hospital insurance. It has a deductible. It covers hospitalization, skilled nursing facilities, home health services, and hospice. And there are some other very large costs that can come into play with Part A, but this only happens if a person is in the hospital for a long time. Part B is medical insurance. It has a monthly premium. Everyone must pay this monthly premium unless they have low income and apply for help to get this premium paid through their state. Some people actually pay a higher Part B premium because they have very high income. Part B has a relatively small deductible. Part B pays 80% of your medical bills. Generally, most non-hospital medical services fall under Part B. You pay 20% of these bills, and there is no cap to your 20% coinsurance. This is how people go bankrupt if they only have Medicare. So to fill the gaps in Medicare, people can get a Medicare supplement. These are also called Medigap plans because they fill the gaps in Medicare. Medicare supplements don't come with fancy names, but rather letters. Plans C and G are popular because they fill most, but not all, of the gaps in Medicare. K, L, M, and N will have lower premiums because they don't fill all the gaps. When I talk to people about Plan F, I say this is the simplest coverage because it offers full coverage. A person should have generally no copays if they have a Plan F because Medicare will pay first. Plan F, the supplement, will pay second. So when a person gets a Medicare supplement, they then should get a Part D drug plan. Now, Part D is voluntary. You don't absolutely have to sign up for it, but if you don't sign up when you are first eligible, you will pay a penalty if you sign up for it 1 year, 2 years, 5 years after you were first eligible. You're going to pay a much higher premium. So what is the cost for this kind of coverage? Well, there's the Medicare Part B premium, and a Plan F in Arizona for a person turning 65 would pay $136. Part D, the cost for Part D ranges from $18 to $90, and this all depends on the prescriptions that you take and what plan fits your needs. The average around the country is about $32. So that's one type of coverage, Medicare plus a supplement plus a Part D plan. Now there is another option, and that is Medicare Advantage. Most Medicare Advantage plans in Arizona have a zero premium, no monthly charge. Most Medicare Advantage plans include Part D, the drug coverage. Most of the Medicare Advantage plans in Arizona will throw in a free gym membership. People like that a lot. And a couple of plans will even throw in a little bit of dental. Not a lot, but maybe cleaning and x-rays each year. So let's take a look at how Medicare Advantage plans work. In Arizona, most of the Advantage plans are HMOs. These are network plans. You must stay in the network of your plan. Referrals are required to see a specialist. There are some PPO plans available in Arizona, but these are more expensive because they allow you to go out of the plan's network. And referrals are not required to see a specialist. With Medicare Advantage plans, there are copays for every service. You'll pay a copay to see the doctor, a copay to go into the hospital, and chemo and radiation copays are generally 20%, and this can add up pretty quickly. You want to ask a number of questions if you're considering Medicare Advantage and a particular plan. Are your doctors in that plan's network? Are all of your doctors? Are your prescriptions covered? and what is the copay for your generic or that brand drug. More importantly are the expensive drugs, the brand drug. What will your copay be? And what is the annual MOOP for that plan? MOOP stands for maximum out of pocket, and this is an annual cap on your cost for the year. This is a protection for you. If you're feeling a bit overwhelmed by all of the choices you have for your Medicare coverage, don't be. I work with doctors and lawyers who are also confused by all of these choices. And there are so many options that you have that it certainly is going to be confusing. So that's why you might want to work with a person like me. I will help you sort through all your choices and help you figure out what the best coverage is for you. And I will even help you qualify for extra help if your income is below a certain level and you qualify to get help with your Part B premium and with drug costs. So my name is Denise, and I am an insurance broker. That means I don't work for one company. I represent most of the plans in Arizona. So if you'd like to give me a call or send me an email, I'd be happy to talk with you and answer questions for you. And I'd be very happy to work with you to figure out your Medicare choices. So thank you very much for listening to this presentation, and I look forward to hearing from you.